Good morning to you, Isabel.
Good morning. And it's quite a moment for Matt Hancock appearing at this inquiry. I mean, there's no doubt that he has been preparing for this moment for well more than a year now. Yeah. He always knew that it would come. And throughout my dealings with him when we worked on his book together, he was always very conscious of gathering the materials and what he would have to say at the inquiry and what might come out of the inquiry. Yeah. And I think, surprisingly, for a man who has basically no self-doubt whatsoever, he is actually a little bit nervous about it.
Yes, indeed. And he probably should be, although we kind of already know an awful lot about what he had to say. Although interestingly, you pointed out last time that you didn't have the month of the March 2020, the crucial 2020, crucially, when in the cache of WhatsApps you got. I mean, what is interesting is I'm very much of the view that from late 2021 onwards, pretty much everyone involved in our pandemic policy, whether it was government ministers, civil servants, or the health advisors, the Jenny Harries, the Whitties, the Balances, everything they did was with an eye not just on front pages and the BBC 6 o'clock news, but also on the pandemic inquiry. And they could say, we did our best. We did everything. I think they realised that the criticism from the mainstream media was going to, and the public was always going to be, you didn't do enough. And so do as much as you can, because then you can't be blamed because you did what you could, given what you know. I like to think that the country is gradually coming round to the idea, the understanding that what they did was far too much and that they did have all the information they needed to not carry out their pandemic plan that they did. Well, the pandemic plan which they threw in the air in mid-March 2020. Do you think we've actually learned anything useful so far in this inquiry?
Well, we've learned a bit. I mean, you said from 2021 they had an eye to the inquiry. I would actually say right from the start, from March of 2020, they had an eye to it. I mean, I have unconfirmed reports, but from very highly and well-placed sources, that there were actually conversations between senior civil servants and ministers within the Department of Health very early on saying, you must be aware that if you get things wrong and if you don't, and you cannot be seen and demonstrate that you were following the best scientific and medical advice, you could face some kind of court action. You could end up in prison. Those were chilling words for any minister facing that crisis as it came down the tracks. It was a huge responsibility. And I've no doubt that the strong political instinct, the human instinct for self-preservation, hugely distorted the response. And as you say, wanting to be able to say we did our absolute best to save lives, almost certainly led them to pursue a policy that ultimately actually cost at least as many and probably many more.
Well, indeed, but their policy was entirely centred. Even the chief medical officer and the chief scientific advisor, Whitty and Balance, it was all about COVID lives. That was the only thing they were concerned about. And repeatedly, when occasionally there was a proper question at a press conference, it would always be about COVID, COVID, COVID. And even when they were asked about what happens in terms of some other costs and benefits when some of the MPs who stood up on this issue asked about that. Well, we've just been asked to give advice on saving lives from COVID. And it is extraordinary because they weren't, Chris Whitty wasn't the chief COVID medical officer. He must have been aware, as must Patrick Vallance, as must all of the people on stage, been aware that there was a cost to a lot of the policies, closing businesses, closing schools and the like, and closing down the NHS to all intents and purposes for a large part of 2020, that would have a knock-on impact. And if they didn't, it was being raised really early on by cancer specialists.
They would argue that it wasn't their job as chief medical officer, as chief scientific officer, to worry about those costs, the cost to the economy, the cost to business, the cost to children in schools. That's what they would argue. But I think where there is a very legitimate point is it probably was their job to think about the wider health costs. And of course, all these things are interlinked. So you might have hoped to have seen more concern about what was happening to cancer patients, for example, just to take an easily emotive one. What you do see in the WhatsApps, for example, from the then Life Sciences Minister, James Bethell, is a lot of concern behind the scenes about the horrific impact on clinical trials throughout the pandemic. So the very vital research that's needed to save and prolong lives across healthcare basically juddered to a halt. They weren't really talking about this publicly, but I can tell you it's certainly something they were worrying about privately.
Yeah, indeed. It's interesting hearing from Professor Dame Jenny Harries, because everyone's got a new title. Everyone involved in the senior level has been given a new title. Everyone got a gong, no matter how badly they did their job. She gave evidence yesterday. She denied there was groupthink among those planning for the pandemic. On the whole, she said scientists are quite outspoken. Well, I mean, tell that to all the scientists who've basically been rubbished as COVID deniers for saying, are you sure this is a good idea? It's not what we planned for deliberately. But she also said the pandemic plan was pretty good. And she blamed, like everyone else has, budget cuts, placing local health officials under significant pressure. And, basically, it's all about austerity. That's the reason why. But the thing is, I
really think this needs to be challenged much more robustly. And we're not seeing that challenged in the public inquiry.
We're not at all, are we?
When you look back to the Leveson inquiry, for example, into media press standards, the interrogation of witnesses there was much more aggressive and challenging than it is here. It seems to me that witnesses here are being allowed to just basically give their often highly politicised point of view without that being challenged. So this issue of austerity, which has come up time and again, and I've said it before, but the word austerity is very politically loaded. It is a left-wing word. Let's not beat about the bush here. Those on the right would call that sensible economics, responsible economics.
And by the way, voted for. The British public did actually, they knew that was the deal. And also, a lot of the spending in the first few years was actually a Labour plan, wasn't it? It was under the previous Labour Chancellor. But this is the thing. In terms of getting to the bottom of this, whenever I've watched into the COVID inquiry, other than, being worried about, pushing my foot through an expensive telly because it's so frustrating. As you say, they aren't being challenged. People, and Carl Hennigan's pointed this out on my show last week, people are giving an opinion and not being asked, what evidence do you have for that opinion? That's been the issue. No one has been asking for evidence.
If I'd just like to finish my point on the austerity thing, because this is important. In fact, it wasn't a lack of capacity that led to such devastating health outcomes during the pandemic, because we had the Nightingale hospitals. They were never used. The government also, at vast multi-billion-pound expense, requisitioned the private sector. So they had the capacity in private healthcare facilities. They didn't use it. So I don't want to hear too much more twaddle about austerity without those other arguments being put forward by someone, please.
Yeah, absolutely. I couldn't agree with you more. And again, when you choose to say we need to save another 95-year-old in a care home's life from COVID as opposed to a 30-year-old mum of two who needs cancer treatment in a completely different hospital, I'm not sure you should be advising the government on anything. I'm really not. It's going to be interesting to watch what Matt Hancock has to say.